there are several things we can do to help prevent the spread of COVID-19 and other viruses, including washing our hands with soap and water, practicing physical distancing, and staying home whenever possible. But what happens if you do come into contact with the virus? COVID-19 is a novel coronavirus, meaning that it is new and we still have room to learn about its characteristics. But here's what we do know. COVID-19 is spread through water droplets leaving the body, which can happen when an infected person coughs or sneezes. These droplets can either be directly inhaled or contracted after touching a surface where droplets have landed. After initial contact, the virus enters the body and begins to invade cells that line the nasal cavity and throat. At this point, symptoms can appear in the form of a headache, cough, or sore throat. This can eventually trigger a generic immune response to the virus, which can cause you to develop a fever. For many people, this may be the end of their COVID-19 infection. In other cases, the novel coronavirus can continue to spread through the body and travel into the lungs. Here, it can attach to the cells which produce mucus and the cells that prevent the lungs from filling with debris. This can lead to difficulty breathing, severe coughing, and pneumonia. In a small number of cases, COVID-19 infection can become critical or deadly. As the immune system works to fight the virus, it begins to produce more white blood cells, which can leak into the lungs. Already filling up with debris and fluid, the lungs may become overwhelmed and unable to carry out their normal functions. At this point, assistance from a ventilator may be required until the lungs can heal enough to return to their normal function again. Although these symptoms and the uncertainty around COVID-19 can be scary, following public health guidelines is the best thing you can do to protect yourself and others from contracting the virus. Keep doing your part, and together we can beat COVID-19.